common inherited heart conditions, and can they be rectified at an early age?
Yes, sir. So when we talk about inherited heart disease, there are two aspects to it. One is they're talking about, structural defects in the heart, uh, which can be, diseases like, for example, if there is a family history of septal defects or cyanotic heart diseases, there is around a 20% chance that, if it's on the maternal side, that the child also will suffer from these diseases. Now, these diseases are very easy to pick up at birth because by any astute clinician, thorough clinical examination often gives a clue, presence of a heart, a pathological heart murmur at birth. Today, there is a very robust ultrasound screening programs that happen in the intrauterine phase itself, where these type of congenital anomalies, structural defects are picked up, and some of them are incompatible with life, so they do them as anomaly scans before the fetus reaches viability to decide that proceed with the pregnancy or not. Now, there are diseases that are compatible with life when the child is born, and then most of them can be fixed either at an elective state once the child gains a certain amount of weight, or they can be fixed even as an emergency procedure as soon as the child is born. Now, fetal cardiology has also progressed, and there is a lot of growth in the field of fetal interventions, where there are certain defects which are picked up later on once the fetus has crossed viability, when abortion is no longer an option, and where you can actually intervene intrauterine to try and fix a problem which would otherwise have led to intrauterine death. So that you give the child a chance to survive and be born, and then you can do the final corrective surgery later. So there's a lot of improvements, a lot of advancements that have happened in the field of this fetal medicine per se. Now, coming to defects which are detected after birth, if there are structural defects, yes, majority of them are identifiable and fixable once the child is born and reaches a certain weight and age. There are also a certain genetic what do you say other defects which are not really, you can't really classify them as structural defects. They are more like the heart is not just a pump that pumps blood. It has chambers, it has electrical system, it has vascular system. Now, very often when people think of heart, they only think of heart attacks.